Hi, this is Dr. Kimberley Linert, author of Visualizing Happiness in Every Area of Your Life and host of this podcast, Incredible Life Creator. And today I have Dr. Amanda Adkins on with me. Hey, Dr. Amanda.
Hello, how are you doing today?
I am great. So happy to
Wonderful.
have you and excited about the topic we're going to talk about taking control of your health. But just so people can know you, I'm going to read your short bio. Dr. Amanda Adkins, MD, is a double board certified internal medicine, lifestyle medicine physician, health strategist, owner of Enlightenment Health and Wealth. She has a deep passion for ensuring that everyone has a chance at a healthy and happy life. Her most recent focus has been to help women who are overweight prevent and possibly reverse chronic illnesses such as diabetes, heart disease, and high blood pressure. Both through her medical and personal experience, she knows how our lifestyle can lead to remarkable changes in our health and our ability to fulfill God's will for our lives. Well, I would like to hear all about it. So tell us about you. Tell us your story, how you got into health, wellness.
Yes, I will start all the way back when I was a 13-year-old girl. I always start with this story so people know I'm not just the doctor, but the actual person that actually experienced different things in life and health. In freshman year of high school, 13 years old, we had to do what they call the Presidential Physical Fitness Test, and we had to weigh ourselves. And I remember stepping on the scale and weighing 199 pounds as like a 13-year-old girl and just feeling devastated at the time because I was just like, I knew I was overweight. I didn't know how much. And I just knew I felt bad, but I was like, okay, this was a point. I was like, I'm never going to let this be my weight be any higher than this. So, what else can I do for myself to make myself healthier? Because I already knew that I wanted to become a doctor. I decided that when I was in sixth grade after a health class. So I was like, I can't be a doctor that's unhealthy and then telling people that they have to do certain things and be healthy, right? So I was like, okay, what else, what can I do? So I decided to start exercising first because I was a person, I still love to do this, but like just sit in the corner and read, go on my own little adventures and through books. But I wasn't very active. So I was like, well, at least I could just start exercising, doing something to move my body. And then at the age of 16, I decided to become a vegetarian. And this is like early 90s. So it wasn't as big now or then as it is now. And the funny part about it is that my father was a meat delivery truck driver at the time. So, right. So we had, a bologna, a sausage, bacon, hot dogs, all those sorts of things. And then at the age of 16, I'm saying to my parents, I'm not going to eat those foods anymore. I'm not going to eat any meat at all. And go from there. So I was losing weight along this time, feeling a little bit healthier. But I just kind of stayed there from vegetarian and exercising when I could. And then just went on about my life, trying to get through high school and then college and then fine through medical school. And then I tell people I was the junk food vegetarian throughout the whole time. So my favorite meal was like a Big Mac with no meat with like a Coke Zero, or back then they had C2, and just going on. And then once I became an attending, one of my patients actually told me initially about Dr. Joel Furman, who talks a lot about, health and wellness with, your lifestyle. And then I went to a actual nutrition conference to do continual medical education course, because we don't learn a lot about nutrition in med school. And one of the doctors there said you cannot out exercise a bad diet. And I was like, oh wow, I don't remember much else about the conference. I'm sure I learned a lot, but that quote just stuck with me and has been kind of like my foundation from going from the junk food vegetarian to eating more like whole food, plant based, and then actually teaching others how to do so. I became certified in lifestyle medicine after like Googling things like, okay, I know about internal medicine because I've been doing that, for several years. But there's something else because other people were asking me, what else can I do besides medication? I'm like, well, they didn't teach us that in med school. And actually just came across lifestyle medicine. I was like, oh, wow, this is what I've been looking for, and what I've been basically preparing for my whole life. And so that's where I am today, now helping others learn about how things that they actually do in their lifestyle can help prevent and or reverse chronic illnesses.
Yes. And everyone wants to reverse chronic illnesses and
Yes,
feel good.
exactly. Exactly.
So I'm so glad that you found that.
Yes, it's been definitely life altering and enlightening for not only myself and others. So that's why I like to call my company Enlightenment Health and Wealth.
Yeah, that's a beautiful, beautiful name. And so, are you still a vegetarian? Did you continue with that lifestyle?
Yes, since 16, I have not eaten any meat. I believe probably around 20, late 2015, 2016, I took out all animal-based products from my diet. So now it's more just vegan and plant-based. I don't eat any of those things at all, and don't really have the desire to go back to them either. So, yes.
Beautiful. And there's so many diets out there. I mean, the opposite is they have the carnivore diet, and the people just eat only meat, not even any vegetables,
Yes.
and then there's vegan, which is no animal products, and there's vegetarian, and some people eat cheese, and some people don't eat cheese. And how do people know what's the best diet for their body? Is there a way to test that or know that?
So I'm just looking at it from like the research I've done and then also some of my patients. And most of the time it is more of a plant predominant diet if you're looking to prevent and or reverse chronic illnesses. If you're just looking to lose weight, then I mean all the diets that's out there, they tell you that they work and they do work to some extent for weight loss in general, but just to be overall healthy, that's where we come and things the diet starts to separate itself. So carnivores, they may eat a lot of protein, therefore they're not eating a lot of like bread and pasta and like I said, vegetables, carbohydrates, and then people burn a lot of fat and lose weight. But then in turn, they're eating a lot of cholesterol and fat, and therefore their blood pressure can go up, or their cholesterol goes high, and eventually their pancreas gives out because it's so much fat, and then they end up with high blood sugars. So you have to look at what your long-term goal is to figure out which diet is best for you, and to know that it's okay to try different things to see what works out for you. And sometimes working closely with someone like myself, a lifestyle medicine or even a functional medicine practitioner, definitely makes a difference, because then you can keep track of how your body is responding to certain things. Because I have some patients that try like keto, and then we're looking at their cholesterol just to make sure and seeing how they kind of respond. And some people do well with that, and some people don't. So you're just working with someone closely to actually look at your numbers, and not just the number on the scale, but other numbers too.
Yeah. So, I personally wake up every morning and I have this green drink. And by green drink, I mean it's got spinach, sometimes kale, spinach, um, celery, cilantro, cucumber, and then maybe a little bit of lemon juice, a little salt to make it taste a little bit better, like some pink salt. And I don't particularly like drinking that, but I know there's something magical about green vegetables, like especially your kales, your spinaches, your whatever, because I know you can get protein, you can get lots of vitamins and different things. So you want to talk about that. Like how much of that green stuff do we need in our diet to be healthy?
Oh, so the leafy greens, I say, is the powerhouse of the diet. If we look at a food pyramid, not the normal one that you would see, but green leafy vegetables should be at the bottom where you eat the most of them. I actually have a mentor that we're on a call, and you can just see him just taking leaves and just eating them. And he was like, "I just want to remind you to just eat your green leafy vegetables." And it's kind of funny to see him do that, but like it's so true, because those they actually heal the artery lining when you actually eat those foods and decrease inflammation for you. And like I said, it has so many other nutrients in there, but it actually has the healing component that we've done so much damage to our bodies. And if you can eat like a big salad at every single meal, that's like great. Or even if you put it in like a smoothie or a green drink, that's good also. But you have to get it in. It's just like if you don't eat anything else, then the leafy greens would be definitely number one, because it's just so much, and it helps with almost every single illness that's out there. So like when someone asks me like, what vegetable should I eat? Like that's always the number one, the green leafy vegetables, and they'll say, I don't like kale, I don't like spinach, but like you said, sometimes you just have to eat it because you know it's good for you till you eventually start to like it.
Yes, exactly. And just from, so I'm an eye doctor. So from the vision eye doctor perspective, there are people who, as they get older, they get macular degeneration and you lose your vision from the center. So, I mean, you can't read anymore from the
Mm,
center. And, the right now, the treatment for it is a shot in your eye. I don't know about you, but I don't really want needles in my eyes. But there's a lot of people going to the doctor every month getting a shot.
mhm. I've heard
And,
of it.
I actually happen to have that in my family, so that's why I make sure and eat the green leafies. So anyone out there who has that kind of history, please be eating your green leafies because you don't wanna lose your vision as you get older from
Right.
something like that. And the other thing I wanted to say is when it comes to, like, spinach especially, I hide it in everything. So I'll put it in my smoothies. I'll put it in spaghetti sauce,
Mm,
because when you heat it up, it's just kinda get mixed in. I'll put it
mhm,
in my
mhm.
eggs. Anywhere where I can hide it or add it somewhere, I just
Yes,
put it in there.
exactly, exactly. That is a good trick that you can do just to like I said, your taste buds change and then you'll start to crave it. Like, where is my spinach?
Yeah, yeah, I think your body starts to crave it because you don't
Hmm.
feel as good. Because I think it, also has kind of a cleansing effect when you eat green, so I always tell myself, "Green is good, green is good."
Yes, I love that. That's exactly right. That's what you want to do.
So, yeah, what other things do people really need to be healthy, like as far as nutrition?
So you want again your green leafy vegetables to start out with, and then you want to make sure you have a variety of foods and colors. So I tell people you like you say you that famous commercial, eat the rainbow, but I was like, not what they're promoting, but the other rainbow. Um, but the different colors of foods actually bring different nutrients for you also. So your orange, your red, your purples, your blues, like it's like with eye health, you have the orange foods. So every color is there for a reason. And so the more you can get of the different variety of foods in color and the types of foods you can eat, you're going to do better. And you can find certain things that you like. I was very surprised at like how many, different types of fruits and vegetables are out there, because people would tell me, "Oh, I don't like vegetables," and I'm like, "Have you tried them all? Have you tried to cook them in different ways? Have you tried to, like you said, hide them in certain ways?" Because the most important thing is just to get them in. Because if you're just trying to avoid them altogether, then you're definitely not going to be healthy. It's going to be very hard to actually prevent and or reverse chronic illnesses if you don't get a variety. I like carrots. I eat those almost every single day. You just like the crunch. So instead of having potato chips, that crunch factor helps out a lot. So if you like, crunchy things, that can actually help. Different like bell peppers, all those different colors, adding that to food. Even like almost all these things you can have raw or cooked. So you don't have to have, fancy recipes. Because I always like to tell people, I'm not a cook either. And sometimes that overwhelms people when they're like, oh my gosh, I have to learn all these ways of cooking something new. And that's not the case. You can try out a few new recipes, but actually just taking some of the food and eating it raw, especially with your fruits and vegetables, just to get the natural taste of the food. And that's the best way to actually consume it, to get all the nutrients. Because sometimes when we cook things, we actually lose some of the nutrients that are there.
Yeah, that makes sense. And another thing I like to do is go to the farmers market. So if you have one of those big farmers markets near you, I
Mhm.
just go and I look and see what they have. And a lot of times I don't even know, I've never heard of these. Most of the time they're labeled what they are. So I have my phone, I'm looking them up. I'm like, okay, what kind of vegetable is this? And what
Yes.
nutrients are in it? You
Mhm.
know, like some weird things like dandelions. Who would think that dandelions would be good for you? But dandelion leaves are actually really good for you.
Yes. You find a lot of new things that you can eat and never knew that you would like to eat them. So it definitely could be eye-opening. So like I said, the farmers market, sometimes just even just your grocery store for some people, because I know I don't have a farmers market always open near me. I love Trader Joe's and Sprouts, and so you can just see some of the things there. So even if you don't have that, so yeah, just explore new things, try something new, take it home, just get a sample of it.
Exactly. And what other things should people be looking at as far as staying healthy, but also, we talked about in your bio, like reversing some of these things because I mean, diabetes is one of the worst things you can have because it affects everything, everything, and it has really detrimental results as you have it longer. Like some people lose their legs or like their vision or,
Right.
you
Their
know,
kidneys stop working, they have a
y-
heart attack. Yes.
yes, yes. So, what are some other things we can do to stay healthy and also to maybe reverse some of this?
Yes. So nutrition, I would tell people it's always number one. Once you can actually get a hold of that, and you don't have to be 100% perfect, but like moving away from a lot of highly processed foods, high sugar foods, high salt foods, to the more natural foods that are grown out of the ground, seed bearing things of that nature. It actually is going to help again heal that inflammation that's in your body, because most of our chronic illnesses are due to inflammation. So that's what we're really trying to get down to, the cause. So it's not like it's a different diet for every single illness. That's why I love, like, if we focus on plant-based eating, that it helps with almost every single illness that's out there, chronic illness, because it helps the underlying root of the inflammation. So eating your different variety of fruits and vegetables, whole grains, beans, legumes, nuts and seeds, because all those different things have all the different vitamins and nutrients that our body needs to decrease the inflammation that's going on. So once you get that, which is why I love lifestyle medicine, it talks about other aspects of your lifestyle that you need to actually be doing also. Like you need to be making sure you're moving all the time, exercise, not just activity. Because some people are like, oh, I have an active job. But I was like, that's not necessarily enough. We need to actually be doing moderate to vigorous exercising at least 150 minutes per week. Not the Sometimes people tell me that 30 minutes 3 times a week is our exercise. That's not going to cut it. To reverse illness, we got to go a little bit higher. Okay.
Mhm.
And we have to make sure we're sleeping well, and sleeping at least 6 to 8 hours. Closer to 8 would be better for adults, because when we actually sleep, our body can repair things that are going on in our body. So if we're having a lot of damage, if we don't have that recovery time and repair, then it's going to be hard to reverse illnesses, right? So you have to make sure you're sleeping. So I really emphasize this in a working class, because it's like, oh, I have a deadline, so I'm really going to push. But you actually do better with your work, and not just your health, but your work, when you actually sleep, because your body is renewed, your brain is renewed, you're able to think better and actually get the work done more efficiently. So we definitely want to look at all aspects of our lifestyle to really help overall.
So there's a lot of people who would like to lose weight for health reasons, for appearance reasons, or they're just tired all the time because it just makes you tired carrying extra stuff around that you don't need. And, there's so many challenges with that. I mean, some part of it's diet, but some people, have some pre-existing conditions, thyroid, things like that. Some of us, I went through it a couple of years ago, horrible. Menopause. I didn't even know what to do with that, but thank goodness it's over. Um, so we have all these issues around, like how do we lose weight? And once we lose weight, how do we keep it off? So, what are some of your suggestions for that?
Yes. So again, with weights, we think of obesity, and keeping on weight and fat around any parts of our body. So again, that's due to inflammation. So we want to try to decrease inflammation in our body. And it definitely can be hard if you're used to eating a certain way. So if you have more of a diet to where you're used to going out to eat all the time, grabbing fast food, it does take more of a mind shift, not just the knowledge to know, but a mind shift to actually say, okay, I'm going to go from doing the drive-through to actually either cooking at home, are choosing actually better options of eating out. So instead of going to, the burger joint, you go to some place that has like salads that you can actually put together yourself. So you don't feel overwhelmed with actually having to make all your own meals, which definitely can be difficult for people that have, families, demanding jobs, or even getting food delivery services that actually pre-make food for you and then deliver those to your home. So that way you already have the healthy food that's there and available, just to get over that hump. So knowing that you will have to make some changes in your mind. I work a lot with women of faith, and so we use a lot of scriptures to actually help change behavior. And that is usually the hardest thing to do. Again, it's not just the food in front of your plate, but actually the behavior change. So when you're going to eat, how much you're going to eat, why you're eating. Are you really eating because you're tired and you're trying to stay awake? Are you eating because you're bored? Are you eating because you're stressed? So actually realizing these different things of what's going on at the time will actually help a lot of people with their mindset change to actually be able to lose weight and keep it off. Because that is definitely the hardest thing. Because like I said, all those diets out there, if you follow them for a certain amount of time, you're going to lose weight. But if you don't make the mind shift to actually say, oh, I'm not going back to what I was doing before, it's hard to keep it off. And that's where you get the yo-yo dieters. So it's basically the mindset shift that you want to make, and working with someone that can really help you through it, accountability coach, anyone like that.
Yeah. So tell me about your faith and how that integrates with your business and your caring for people.
Yes. So I tell them that's just the root of who I am. So like growing up Christian, just learning about God and faith and spirituality, scriptures is just like, okay, I was using those for like just to get through stressing times and things of that nature. But as I got older and people were like, well, how did you keep doing this? How did you keep staying a vegetarian, not going back to meat? How did you keep your weight off? And I was like, well, it was a conviction for me to know that I had a higher calling and that I needed to be that example for someone else. And
Mm.
so I would take, different scriptures, which like I still have, and, have those posted, in like my closet, sometimes in my car, just to kind of continuously renew my mind to know that I am different. I don't do those things anymore. That's not my identity. And when you have that identity shift, you're less likely to go back to what you were doing before, whether it's in, your health and wellness, career path, whatever you're doing. Once you have that shift, you can actually make a difference. And I just have people pick out different scriptures, or I show them different scriptures that I've used in the past and have them meditate on those to, again, just help to renew their mind and show that they can actually make a difference. Because once you have a mindset shift, you're going to make the changes. The other changes are going to come for you. So it makes it easier because I'm a Christian. So when Christian women hear that, I was like, oh yeah, that makes sense. You're being helped in every aspect of your life with the scriptures.
Beautiful. So there's something that's becoming, it's probably been popular for a while, but now it seems like it's even more popular. They have these new drugs out. What is it? Ozempic and semaglutide and some of these. I mean, for years we had these diet pills, but they're all just kind of full of caffeine and hyped you up. But now they have this other stuff. And I'm thinking, is that good for you? Is it terrible for you? I mean, if you're making the lifestyle changes along with using it, is it good, or is it just like, no, you should never touch that?
So I never say no, you should never touch that. And some of my patients actually were surprised because they said, I was hesitant to come and ask you about these medications and if I should start on them or not. And so we just kind of work through what the benefits are of the medication, the side effects. Is it really worth it? Are you willing to still make those lifestyle changes? Because you will lose weight if you don't make them, but will you be healthier? So, I mean, I know the studies say that it still can help reduce cardiovascular disease, but it doesn't go to zero. I mean, it's like 20 something percent that it helps reduce. But if you make the lifestyle changes and you can actually reverse, that's what I always emphasize to people. So we want to not just manage these illnesses, we want to reverse them. And I have no problem still prescribing. I do have some patients that do take some of these medications, but just for them to know that we don't know the long-term effects. I just saw an article the other day that's talking about how there's some other side effects that they didn't recognize initially, and I was like, that's what's going to happen. Like the more people are on it, the longer they're on it, they're going to likely find more side effects of these medications that could possibly occur. But I also like to tell people that just because you go on medications doesn't mean that you're a failure. You can use that as a prompt to actually help you to get started, because unfortunately we live in like a microwave society. We want results and we want them now. And if they don't see them, then they're likely to give up.
Mhm.
So if you want to do that, I have some ladies and gentlemen that say, okay, I just want to do this for now, and then see if I can get the lifestyle changes going, and then keep with the lifestyle changes and come off the medicine. So some people are using it that way. And I usually remind them that when you do come off the medicine, you will see some weight gain, because that's what the studies do show, that weight regain does occur after you stop the medication. And it's not like it's all roses. You will have side effects from the medication. So just be prepared for those also. Nausea, diarrhea, constipation, upset stomach, it's not just like, oh, I take it and the weight will just melt off. It's not always just like that.
Got it. Yeah. And the one thing about something like that, or even doing lifestyle changes where you're actually making some pretty big lifestyle changes, is once you start seeing the changes, it kind of gives you that kickstart, like, oh, I feel better. It's kind of like when you start walking or going to the gym, and at first it's so hard, but
Right.
then, you go out to work or whatever, and people are going, hey, you look different. You look better. They might not
Hmm.
even be able to pinpoint it. And you're like, oh, I do feel better. And you look at yourself and
Right.
I do look better. And it
Hmm.
encourages you to keep going, because sometimes we
Yes.
just need that,
Yes.
whatever it
Positive
takes to
reinforcement.
get it going.
Exactly, exactly. And I even try to emphasize to some people, especially my clients that I work with coaching, is that in as short as 5 days, you can actually see some results from your lifestyle changes. Even if it's not the weight loss that you're looking for, you will likely be sleeping better, you'll have more energy, your skin will be brighter, you'll have less joint pains. And so sometimes just those things will reinforce for people, okay, I'm doing the right thing, I'm going to keep going. So you just have to look at all the good things that can be occurring, not just the weight loss.
Mhm. Yeah, and you're talking about like reversing these diseases, and I know a lot of times my patients will say, "Well, I'm a diabetic." And so
Mm-hmm.
they're actually identifying as a diabetic.
Mm-hmm.
And the thing is, we really are not a diabetic. We are not the disease.
Right.
But people say that, and our words are so powerful. So I know when
Mm-hmm.
I have patients come in and they say, I'm a diabetic, I'm like, no, no, you're not a diabetic. You have diabetes, because as you're making these lifestyle changes, you, who you are and your identity changes, because all of a sudden now I'm a healthy person. I'm not, and like you said, it can reverse. I've seen it over and over again. People, diabetes, high blood pressure, getting the thyroid, everything just going to normal. Not only normal, but their numbers look better. And so they
Mm-hmm.
are no longer whatever they were naming themselves. They are now a healthy person. And so they make decisions from the brain of a healthy person.
Yes, yes. And I'm glad you mentioned that, because it actually took a me taking a class that actually helped me to reframe that also. Because I would say, yes, this person is a diabetic, like you said, but no, you have to actually reframe that for the patient. And so I actually noticed that I start saying it differently also to them, to actually show that that's not who they are. That's just one of their diagnoses. And so that's true. That definitely does something different in your mind when you actually have that. So I'm glad you mentioned that, because when you're saying that, I'm like, oh my gosh, yes, I remember someone mentioning that. I was like, okay, I have to reframe the way I actually talk to patients also, which makes them feel different
Mhm.
when you mention it that way too. Yes.
Exactly. So here's the big word, and people put this word all over everything. And even so, even though it's been generalized, we all know that stress causes inflammation and disease. So please talk about that.
Yes. So stress is definitely a big one, especially in today's society. And some people have different stressors, and we have sometimes mostly chronic stress, not just because some stress is good. Like you want to have stress like the fight or flight type of thing. When something is endangering you, you want to be able to react and respond quickly. But you don't want that chronic stress because that builds up that inflammation, like you were saying, in our body. And so that is one of the things that we actually talk about in lifestyle medicine, is to manage that stress and to actually be able to renew your mind, whether it's like going for a walk, not just for exercising, but to actually be able to breathe and take a deep breath. And I've been doing this. Like I said, I'm the example. I live it out personally. When I'm actually working, I make a choice during my lunch to take 30 minutes and go out and just walk. And I know people are like, how does she have time to go walk and she has to do these things? But it renews my mind. It actually, I breathe, I pray. And I was like, it gets me ready for the next half of the day. And I really encourage patients to do that also for themselves. Like you have to find what you can do every single day to get rid of that stress, because you don't want it to build up. And you don't want to say, oh, I'll, exercise 3 times a week, because that's not going to help. You have to do something every single day to relieve that stress for the day or prevent it from coming, to actually be able to know your triggers for stress. I've been able to recognize those sooner. For me, it's like being late and things like that. So if you know that that's going to happen, okay, I know I get triggered by X, Y, and Z. So I'm going to do A, B, and C when that happens to prevent this from coming on. And it's different for everybody, but simple breathing exercises I went through with a meditation coach that, taught me how to breathe and make sure that I'm breathing, because we'll be surprised how often we're not breathing. like, oh, I didn't take a breath there, or even laughing, which I get people cracking up all the time. Like, even if you don't feel like laughing, just making yourself laugh will cause you to laugh harder, which then like releases stress in your body too. Which I love to just show people to do, and you just start laughing. And then before you're like, you sound crazy enough that you're just going to crack up laughing, and others will start laughing around you. So different things like that you can do on a daily basis to just relieve that stress, so it doesn't become chronic stress that then leads to the inflammation, that then leads to the diabetes and the high blood pressure, or the depression and the anxiety. So all those things we can do to just help our health overall.
Yeah, exactly. And I totally agree with you. So I actually was seeing patients today, and at my lunchtime, I always go to the park and I walk. And today I walked, and then I had a seat for a while and did a little meditation. So you're out in the nature, you just can
Hmm.
expand out and feel better, breathe. See, being at a park, I could hear kids laughing.
Yes.
You can hear the birds. I took pictures of butterflies I saw. I saw some grasshoppers. I'm always taking pictures of flowers or some kind of animal or bug or something I found. But, it just gives you a little break during the day, not only just relaxation, but it gives your whole mind a break.
Mhm.
And there's something about nature, talking about our
Yes.
creator in nature. I think personally, I feel the closest to God when I'm out in nature.
Exactly. Yes. That's a good thing. I actually started hiking when I came to California, just because I was like, initially it was just for exercise, but how much it relieves my stress when I'm out there. And like I said, it's a different thing. Even though I'm in the middle of a big city, to go out there and just like you said, hear the birds, see different microclimates, how it's like wet over here and real dry over here, and just the smells of the different flowers or the different plants that are out there, and touching the life that's there just brings life to you, and it does something different than running on a treadmill in a gym. It's nothing the same. Even though you may burn the same amount of calories, it's totally different on how your body reacts. And I would definitely recommend that to everyone. I can't remember the last time I was in a gym. Well, I guess when I go to hotels or something, but otherwise I try to be outside. So it's like it's a whole different world. So if you're usually a gym rat, I recommend that you go outside at least 2 or 3 times a week, instead of going to the gym and do something different outside. It will definitely change your whole outlook on the day and life.
Yeah, beautiful. So if people wanted to connect with you, contact you, where do they go to do that? And also, what services do you have available for people?
Yes, so you can go to my website at www.dramandamd.com. That's spelled DRAMANDAMD.com. And there you can book a free coaching consult call with me, or learn about other services I have. Sometimes I do group classes for people. And then I'm also on social media, Facebook, Instagram, and YouTube at Dr. Amanda Adkins, and it's spelled ADKINS. And mostly now I am doing lifestyle health and wellness coaching. So people can always look out for that.
All right. Well, thank you so much. So now I have a personal question for you. What gives you the most happiness and fulfillment in your life at this point?
So I'll have to say my 4-year-old daughter. I could not imagine life without her now. It was just whenever she's around, she just kind of lights up the world. Like it just makes you think back to when you were younger and like the possibilities, and not to be so closed-minded. She keeps me grounded and saying, "No, you can do that. You can do that." And just to see her try new things, it's amazing. Like I'm just amazed. I'm like, if she can do that at 4 years old, surely I can do that when I'm like 45. Let me go ahead and explore something new. Like she's not hardly afraid of anything. So I'm just like, I need to be more adventurous like her, like a 4-year-old. And if your mind is opened up to so many possibilities, you like it's just like amazing. So I keep her around as inspiration and try to capture all those points. So then when she's older, it's like, remember your 4-year-old self. You said you can do it.
That is beautiful. I love that. Well, thank you so much for being on the podcast today and for all your wisdom. And hopefully, people will grab a hold of that and be healthier and feel better.
Wonderful. Thank you so much for having me. I enjoyed talking to you today.
So, yeah, so I have one last question before we finish. What is your best advice on living an incredible, amazing life?
So I would say remember that your health journey is a journey, not a destination, and always give yourself grace when you're actually making changes and as you continue to grow. And always eat your fruits and vegetables at every single meal.
All right. Thank you so much, Dr. Amanda.
Thank you.
Yeah, we'll talk to you again soon.